Hello, everyone. Welcome to our presentation.
Wait. Okay, go. Okay.
Hello, everyone. Welcome to our presentation. Our group project is based off oral-facial myofunctional therapy, or also called OMT. Our particular research question is how we can incorporate oral myofunctional therapy into dental hygiene curriculums. So let's get into what is oral myofunctional therapy. Oral myofunctional disorders involve behaviors and patterns that create improper muscle function and improper habits that affect the tongue, the jaws, the lips, and the face. Oral myofunctional therapy involves individualized regimen exercises that repattern and restructure oral facial muscles. It specializes in therapies and exercises that are used to eliminate pain and improve muscle function and correct detrimental oral habits and assist with long-term benefits of orthodontic and malocclusion surgeries as well. The benefits are non-invasive, they are a holistic approach, and they can be reversed. These are an adjunct to dental treatment for a range of disorders. So let's talk about the history of oral myofunctional therapy. It starts with Edward Engel, who is the father of modern orthodontics in the early 1900s. He was the one who originated the concept of oral myofunctional therapy by asserting that oral soft tissues and pressures, as well as respiratory problems, were the common reasons for development of malocclusion. Then his student, Alfred Rogers, then took that a step forward and asserted that proper muscular function needed to be established through exercises rather than assuming it would follow good occlusion. Then Walter Straub, who was a person who embraced Rogers' theories, became the most well-known clinician to practice OMT in the 1960s and 70s. And then he also postulated that incorrect tongue function, infant bottle feeding, improper sleeping, and improper breathing habits were the primary cause of malocclusion. From then on until now, OMT has gained a lot of recognition, and clinicians have started to offer in these services mainly through the allied health type of clinicians like nursing, dental hygiene, dentists, and chiropractors, and speech pathologists.
So we're used to seeing oral myofunctional therapist. So basically, the umbrella is pretty large. Some of the major ones that stand out to us as dental hygiene students is sleep disordered breathing or sleep apnea, malocclusion, and TMJ disorders. Why is it important to us? This actually provides us optimal oral health care by using the ADPI process. Oral facial disorders would be included as part of the extraoral intraoral assessment. And dental hygienists would undergo certification in the area of OMT. Some pros and cons. OMT evaluation is within our scope, but is no longer debated within the dental community according to 2019 CDHA. Therapy is reversible, which prevents us from malpractice suits. Unlike surgery, which is a more permanent option, OMT can also be considered holistic, a comprehensive approach to multiple disorders. The more knowledge we or guidelines we establish, the more prevalent OMT will be practiced. A couple cons are not all dentists are aware of OMT. There is limited knowledge in this field. Patient compliance and commitment, and then there are some really medical and dental issues along the way. OMT certifications are out there. Programs that are offered are the Academy of Orofacial Myofunctional Therapy, which is AOMT, and the International Association of Orofacial Myology. These are a list of the types of certifications available to us as clinicians once we graduate. Recertification is every 3 years.
So here are some cases. The first one is a mouth breather. So there was behavior modification techniques and retraining was implemented to promote the lips together, proper breathing. And as we all know, mouth breathing changes the maxilla, the nose, the neck, the shoulders, and can be linked to gum disease, sleep disorders, TMD, and behavioral issues. The next case is a tongue thruster. So in this case, the tongue pushed against the teeth during swallowing, but instead of pushing up towards the palate, the tongue moved anteriorly. So the OM therapist promoted lip sealing and breathing exercises. The next is a tongue tie patient or ankyloglossia. It's a restriction of the lingual frenum. In this case, the OM therapist referred the patient to a release restriction and repatterned the tongue muscles for maxillary benefit following the procedure. And then the last is a case of poor oral habits of thumb sucking with a pacifier, nail biting, facial mannerisms, hand leaning, which can affect the tongue rest posture, TMJ mastication, and the OM therapist ended up eliminating these bad habits and coached the family on long-term success in this case. So thank you so much, and here are our references.
Thank you.
Okay, what's some time next?
Great.